We're going to be talking about a hydatidiform mole or molar pregnancy, and I'm going to explain what exactly this is and your role in providing care. So when there is a hydatidiform mole or molar pregnancy, there is abnormal fertilization that has occurred. So abnormal fertilization. So with this, it is not viable. Let's talk about how this happens. So they can form in two ways. So either there is an ovum, so we have the egg, the ovum, and there's no maternal DNA. So it's just an empty egg. Or you have an ovum and it is fertilized by two sperm. So too much DNA. So this is going to create a non-viable, non-cancerous tumor. A molar pregnancy can either be complete or incomplete. So let's talk about that. A complete means there's no fetal material. So there's nothing fetal about it. It's just a molar pregnancy. And you'll see I have a picture on the next slide to show you. With an incomplete, this means, incomplete, it means it's partial. So a partial molar pregnancy. With partial, it means there might be some fetal material, but no fetal heart rate ever present and never viable. So with a hydatidiform mole, we want to know, what is a mole? Okay, what does this mean? It is a clump of growing tissue. The molar pregnancy takes on grape-like clusters. So if you see in here in this ultrasound picture of the uterus, these grape-like clusters, just these little circle clusters. It is a distension of the chorionic villi. Remember, the chorionic villi is what attaches into the uterine wall it makes into the placenta. So an overdistension happens of these and it forms these grape-like clusters, and they're going to fill up the uterus. The molar pregnancy will almost always result in a miscarriage, but there is rarely any fetal material. So miscarrying this pregnancy, for lack of better words, but when you're miscarrying this molar pregnancy, you're not going to get rid of fetal material, okay? It's just going to be, you're miscarrying these grape-like clusters. So with this also, it usually means we're going to have a D&C to help remove all this extra clusters of tissue and clean everything out of the uterus, because it can develop into a choriocarcinoma. Usually they're benign, but it could become invasive and malignant. So on assessment of this patient, what does she look like? She's going to have a fundal height that is larger than expected because that uterus is filling fast with those clusters. And so the uterus is going to grow faster. There's never any fetal heart rate. The patient can have high blood pressure. The BP rises. It's just a side effect of this type of pregnancy that you'll see higher than normal blood pressures. There's vaginal bleeding. Now, remember, it is going to be grape-like clusters. It's going to be bright red to dark brown of clustered bleeding coming out of the vagina. And then HCG. So she still can have that positive pregnancy test. She still has HCG, and she actually has a quick rise in HCG. So it's rising quickly, and that's going to create nausea for the patient because of all the extra hormones. Let's discuss what our management is going to look like for this patient. So remember, we have to have a D&C happen, and that's going to be a vacuum aspiration to remove the contents. The mole is going to have to be sent to pathology. And why would that be? It's because we need to make sure it has not become malignant. When it becomes malignant, this molar pregnancy has now turned into what we call a trophoblastic disease. We're going to need to give the patient oxytocin because that's going to help contract the uterus. to get it back down. Remember that uterus has grown quickly, so we need to contract to quickly get it back down to the pre-pregnancy state. Methotrexate, so this is given IM, and what this is going to do is going to inhibit the cell division, that rapid cell division that's happening to form all those grape-like clusters. It's going to inhibit this so that it won't keep happening. It'll slow it down. And then HCG. So this is lab work. It's going to be done. We're going to watch until the baseline HCG level is reached, until we're at a non-pregnancy state. This patient cannot get pregnant, no pregnancy for 1 year following a molar pregnancy. So she's going to need contraception. What do we want to educate her on? We want to give her resources that she needs just to help her coping with the loss of this pregnancy. Although it wasn't a viable pregnancy, in her mind, she still thought she was pregnant. And it's a lot to process because now she can't conceive for a year. So we want to give her some resources to help and offer explanation as to why it's a non-viable. Remember, they get that positive HCG level in their urine. And so we want to help give an explanation as to why this is not a viable pregnancy, because it's so rare that they probably haven't even ever heard of it. And then methotrexate use. So we're going to be giving IM, so they need to know that, and then how often that they're going to be getting it. And then contraception for a year. So just finding out what the best contraception method is going to be for that patient, because she needs to be on it for a year to ensure that she doesn't get pregnant until all of this molar pregnancy has completely resolved. So our nursing concepts for somebody with a hydatidiform mole is going to be coping, lab values, and reproduction. We want to help her cope through this. We're going to need to be monitoring lab values. If you remember, we are monitoring specifically the HCG to see it get down to baseline, and then help her with this reproductive process. All right, our key points. So if you understand these, it'll just kind of help bring it all together. So a hydatidiform mole is non-viable, it's never viable, and there's never any fetus. Remember that if there was complete or incomplete or partial. So with partial, you might have fragments or pieces of a fetus, but never any fetal heart rate. There's improper fertilization, so either one egg, one ovum, and 2 sperm, or an empty ovum and a sperm. There's dark brown to bright red bleeding. That's going to be one of our symptoms. It's good to know. And remember, a lot of times it's those clusters, those grape-like clusters. And then methotrexate, an IM injection, and that's going to inhibit that rapid cell division. And then contraception, 1 year of contraception. Make sure you check out the resources and the cheat sheets attached to this lesson. Now go out and be your best selves today, and as always, happy nursing.